Ever wondered how respiratory infections can affect horses? Well, it's a topic of great relevance to those who care for these magnificent animals. Respiratory infections in horses can range from mild to severe, disrupting not just their health but also their performance. These infections can be caused by a trifecta of pathogens, viruses, bacteria, and even fungi, affecting the horse's respiratory tract, including their nasal passages, sinuses, throat, and lungs. Over the next few minutes, we'll delve into the intricate world of these infections, shedding light on their causes, the symptoms they present, how they're diagnosed, and the treatments available. We'll also discuss prevention strategies because, as the old saying goes, prevention is better than cure. So whether you're a horse owner, an enthusiast, or someone keen on equine health, this exploration will prove insightful. Stay tuned as we dive into the causes of respiratory infections in horses. So, what causes respiratory infections in horses? It's a complex interplay of factors, but let's break it down. First off, we've got viruses. Equine herpes virus, equine influenza virus, and equine rhinitis viruses are the usual culprits. These viruses invade the horse's respiratory system, triggering an immune response that leads to inflammation and, consequently, symptoms of infection. Next up, bacteria. Streptococcus equi subspecies equi, commonly known as strangles, Rhodococcus equi, and a host of other bacterial species are known to cause respiratory infections in horses. These bacteria can colonize the respiratory tract, causing damage and disease. Then we have fungi. Fungal organisms such as Aspergillus and Rhizopus species can lead to fungal pneumonia and other respiratory issues, particularly in horses with compromised immune systems. The spores of these fungi are often present in the environment and can be inhaled by horses, leading to infection. Finally, let's talk about environmental factors. Poor ventilation, overcrowding, and exposure to dusty or moldy environments can all contribute to respiratory infections in horses. When horses are kept in these conditions, their respiratory tracts may become irritated and inflamed, making them more susceptible to infection. It's also worth noting that a horse's age, overall health, and immune status can influence its susceptibility to respiratory infections. Young, old, or immunocompromised horses are typically more at risk, so that's the lowdown on the causes of respiratory infections in horses. From viruses and bacteria to fungi and environmental factors, there's a wide range of potential culprits. It's a complex issue, but understanding these causes can help us better prevent and manage these infections. Now that we understand the causes, let's explore the symptoms of respiratory infections in horses. How can you tell if a horse has a respiratory infection? Well, there are several signs to watch out for. The most common symptom is a persistent cough. This could be dry or moist, and it's often more noticeable during or after exercise. Another symptom you might notice is nasal discharge. This can range from clear to yellow or even green, depending on the severity of the infection. A horse with a respiratory infection may also have a fever, which is usually accompanied by a loss of appetite and lethargy. These are general signs of illness that show your horse isn't feeling its best. Difficulty breathing or an increased respiratory rate can also be signs of a respiratory infection. This might look like flared nostrils, labored breathing, or a heaving flank. In some cases, like strangles, there may even be swelling of the lymph nodes. Recognizing these symptoms is crucial for timely diagnosis. Let's discuss how vets diagnose respiratory infections in horses. How do veterinarians diagnose respiratory infections in horses? This is a question that many horse owners may have. The process is thorough, systematic, and tailored to each horse's unique situation. The first step is a comprehensive physical examination. Veterinarians assess the horse's overall condition, focusing on clinical signs such as fever, coughing, nasal discharge, and any signs of respiratory distress. They also listen to the horse's lungs using a stethoscope, checking for any abnormalities in the sounds. Then, to identify the specific pathogens causing the infection, veterinarians may collect samples from the horse's nasal discharge. This technique, known as nasal swabbing, provides a sample for laboratory analysis. The lab can then identify the viruses, bacteria, or fungi present in the sample, giving the veterinarian valuable information about the cause of the infection. Blood tests form another crucial part of the diagnostic process. These tests can detect the presence of antibodies against specific pathogens in the horse's bloodstream. The presence of these antibodies indicates that the horse's immune system is actively fighting an infection. Blood tests can also reveal if the horse is suffering from any other underlying health issues that could be contributing to the respiratory infection. In cases of suspected pneumonia or other severe infections, veterinarians may opt for imaging, such as radiographs or ultrasonography. These imaging techniques allow the vet to visualize the horse's lungs and assess the extent of the infection. Each of these diagnostic methods plays an integral part in accurately diagnosing respiratory infections in horses. They provide valuable insights into the condition of the horse and the nature of the infection, guiding the vet towards the most effective treatment plan. Remember, once diagnosed, timely treatment is essential. Let's see how these infections are treated. So, a horse has a respiratory infection. What's next? Treatment for respiratory infections in horses is multifaceted, aiming to eliminate the infection, alleviate symptoms, and support the horse's overall health during recovery. The cornerstone of this treatment is often medication, the type of which is heavily dependent on the source of the infection. For bacterial infections, antibiotics are typically the go-to. They're administered based on the results of culture and sensitivity testing, which helps to pinpoint the most effective antibiotic for the specific strain of bacteria causing the infection. It's crucial to follow the prescribed dosage and duration to avoid complications or resistance. If a virus is the culprit, the approach is slightly different. As viruses don't respond to antibiotics, the main focus is on supportive care to help the horse's immune system combat the infection. This might include antiviral medications, though these are less commonly used in horses than in humans. In either case, anti-inflammatory drugs, specifically non-steroidal anti-inflammatory drugs or NSAIDs, can play a crucial role in treatment. These help to reduce fever and inflammation, making the horse more comfortable and potentially speeding up the recovery process. Beyond medication, symptomatic treatment is often necessary. This might involve fluid therapy to maintain hydration, especially if the horse has been off its feed or has a fever. Nebulization, the inhalation of medicated mist, can also be beneficial, particularly for horses with lower respiratory tract infections. This can help to open up the airways and deliver medication directly to the lungs. Last but not least, good old-fashioned rest is key. Just like humans, horses need time and peace to recover from illness, so limiting exercise and ensuring a quiet, comfortable environment can do wonders. Remember, every horse and every infection is unique, so treatment should be tailored to the individual horse and its specific diagnosis. It's always best to work closely with a veterinarian to determine the optimal treatment plan. Treatment is one side of the coin. Next, we'll talk about prevention. How can we prevent respiratory infections in horses? The answer lies in a combination of measures. First up, vaccination. Regular vaccinations against common respiratory pathogens like equine herpes virus, equine influenza virus, and strangles can significantly reduce the risk of infections. Then there's biosecurity. Implementing strict biosecurity protocols, such as disinfecting equipment, limiting visitor access, and regular hand washing, can prevent the spread of infectious agents between horses. Good stable management plays a crucial role too. This means providing clean, well-ventilated stabling, minimizing exposure to dust and mold, and ensuring horses have access to fresh air and sunlight. Lastly, quarantine. Isolating new arrivals and horses showing signs of respiratory symptoms can prevent the spread of infection to other animals. This includes not sharing water buckets or feed tubs and maintaining a safe distance from other horses. Remember, prevention is always better than cure. It's not just a saying, it's a principle that can save your horse from unnecessary suffering. To wrap up, respiratory infections are a common health issue in horses. These conditions can be triggered by various factors, from viruses like equine herpes virus and equine influenza virus to bacteria such as Streptococcus equi, and environmental elements like poor ventilation and overcrowding. Symptoms can range from coughing, nasal discharge and fever to loss of appetite, lethargy, difficulty breathing, or in severe cases, respiratory distress. Remember, if you suspect your horse has a respiratory infection, consult with a veterinarian immediately. Stay informed and keep your horses healthy. If you found this video helpful or interesting, show some appreciation by hitting the like button and subscribing for more. This helps us a lot, so we can make more informative videos about horses.